All right, welcome guys. Today we'll be discussing the pelvic gird very quickly. Just to warn you that this part of anatomy is very disturbing in the beginning because this bone is very irregular in shape, multiform, as Syrisky wants to know about it. This bone is very difficult to really understand how it's situated in the body. So for that, you need to look at so many different pictures to really understand how it's situated. And I advise you, when you go to the lab, please look at that bone and try to get the two hip bones together, put them, and understand how the sacrum is situated so that you know exactly what's anterior and what's posterior, what's lateral, what's medial, and how everything is attached to each other, and then know exactly the parts of it that we're going to be discussing in a bit. Um, I will always try and give you a way in which a speech is articulated. That's why I'm here. I don't want to go into super details of every single point mentioned on this book, but it's for your studying, for your understanding. It explains every single detail on there for you to be able to construct a good speech for Syrisky's answer. So if I'm asked about the pelvic gird, I would start by saying this general features of this gird. Well, first and foremost, it is an irregular multiform bone. Always use the multiform bone thing. And the pelvic gird is made up of two hip bones. And what are the hip bones? It's basically two of those right here. And when I'm pointing at this part right here, where I'm pointing at with my mouse, um, the this is the lateral part. This is the lateral right hip bone. Lateral, lateral part of the right hip bone. And if you see, that's the pubic symphysis. This is where the pubis crest or tubercle is found to exist. Okay, um, just directly. Now, you need to start by saying, yes, so two hip bones are joined together, and posteriorly, where I'm pointing right here, we find the sacrum just joined to the alus of the ilium. Okay. Now, before I begin, I want to point out that Syrisky sometimes likes to talk about the pelvic inlet and the pelvic outlet. So if you take this pelvis, this pelvic gird with the sacrum attached to it, and you look into it, you see that there's a pelvic inlet. And if you flip it and look from up, from like looking up at it, just to look at the inferior part of it, there's a circular part called also the pelvic outlet. And I'm gonna quickly, before diving into the details of it, I will just bring it up because they might bring those for your practicals. So the pelvic inlet, right? So the pelvic inlet is basically that circular part that you see, just aligned between the two hip bones and posteriorly the sacrum. That's how I would start. I would say pelvic inlet, pelvic outlet. The pelvic inlet. Um, um, well, we're now talking about the practical side of it, okay? Not the orals. If the orals, just go dive into the details of the hip bone, and I will just go in a bit. So now I'm just diving into the practical part because I think he will mention the pelvic inlet and pelvic outlet in your practical. So one thing you have to mention about the pelvic inlet is that what makes up this circular border right here. Um, you need to know exactly what those boundaries are in this circle. So in the beginning, I would start by saying posteriorly, the pelvic inlet is made up of the promontorium of the sacrum, right here, okay? The promontorium of the sacrum is just the part of the sacrum that is in the middle and in the posterior aspect. Then I'm gonna say, where is it? Yes, then I'm going to say that uh, going laterally, I will be passing on the iliosacral joints on this part, one and two. So I now I just stated everything on the posterior aspect of this pelvic inlet. Now I'm going to go on the lateral aspects, okay, of this. It's made up of the arcuate line of ilium right here, boom and boom. And then I'm going to say anteriorly, it is made up of the pectinal line of pubis and finally the pubic crest. Easy. Okay, that's the borders. Now he wants to also know the diameters that are present in the pelvic inlet. And they are three: one, two, and three. The first one, anteroposteriorly, that extends from the promontorium to the pubic crest, is 11 centimeters. Okay, and as I said, it extends from the promontorium sacrum to the upward of the symphysis of the pubis. Next, the one that is horizontally, okay, transverse diameter. It is 13 centimeters and extends between the farthest point of the arcuate lines, boom and boom. And finally, the oblique diameter. The oblique diameter is found diagonally. It is about 12.5 centimeters, extends from the sacroiliac joint, as I told you right here. These are the two things that you have to mention according to the promontorium, the two sacroiliac joints on the posterior aspect of the pelvic inlet. So it extends from the sacroiliac joint on one side here and up until the iliopubic eminence of the opposite side. If you did, now we will just go over what the iliopubic eminence is, but it's from its name, it's the place where the ilium, and the pubis join. Okay, so boom, that's it. Pelvic inlet done. That's what you should be doing for the pelvic inlet. Pelvic cavity. You will be studying more about this in when you're studying the organs present inside and stuff like that. Um, um, but quickly here, most importantly, the superiorly, it's saying that plane of the pelvic inlet. So it's just the empty plane, okay, pelvic inlet. Posteriorly, the sacrum, as I mentioned. On each side, you have the pelvic surface of the ilium and ischium. So if you scan that on the inside, if you're inside the pelvic inlet, here on these sides we have the pelvic surface of the ilium and ischium, and anteriorly we have the symphysis pubis right here, pubic symphysis, and the two pubic rami and obturator foramen. Um, you will see anteriorly, here, there we go, this is the obturator foramen. These are found, two of them anteriorly, okay? And inferiorly, we have plane of pelvic outlet, and that's what we're gonna discuss next, the pelvic outlet and its borders. And well, the diameters here is not important as it is important the pelvic inlet, but the pelvic outlet. So imagine you have let's say so that I can really explain to you how things are going. Imagine there's a baby within a woman's womb. Okay, that baby would be passing through that pelvis. Okay, the pelvic gird space, pelvic inlet, pelvic cavity, pelvic outlet. That's how it is. Okay, so anteriorly in the pelvic inlet outlet, we have the conjoined ischiopubic rami, and inferiorly pubic ligament. Okay, and they're labeled right here, boom and boom. Okay, those two things. Laterally here we have the ischial tuberosity and the sacrotuberous ligament. Ischial tuberosity right here, and the sacrotuberous ligament. Tuberous comes from the ischial tuberosity. So on the sides I have the ligaments and the ischial tuberosity, like laterally. Posteriorly now I have the tip of coccyx. So what is the coccyx? As if you study the vertebral column, you will see that the sacrum ends with the coccyx. Okay, so the pelvic outlet posterior is made up of the coccyx. Laterally, it is made up of the ischial tuberosity and the sacrotuberous ligament. Anteriorly, it is made up of the conjoint ligament, conjoint ischiopubic ramus, and the inferior pubic ligament. Okay, and that's it. What you need to know. I don't think you need to worry about the diameters, but if you're interested, go ahead. But most importantly, the diameters of pelvic inlet that syrisky likes. That's the start of like the practical issue. I wanted to just mention it really quickly because sometimes he gets it. Now let's dive into the structure of the pelvic gird itself and what makes up this pelvic gird. Made up of two hip bones. The hip bones, each hip bone, now we'll just isolate one and look at it. The hip bone is made up of ilium, ischium, and pubis. The ilium is the most superior part, and it's a plate, and it's two plates actually. If you touch your hips, let me just stand around this part, okay, you will see that there are like plates that extend back just below your kidneys as well. And then the anterior part, there's like two pointy bones right here. These are the within the anterior border of the ilium, okay? First, we're going to discuss the ilium. Some important aspects of the ilium is that it has an iliac crest This part right here has it's called an iliac crest, okay? And these plates right here of the ilium are called the alas of the ilium, okay? The ilium itself, okay, now we're going to dive into it, has anterior border, posterior border, and maybe a medial border, okay? And I will dive into it. In a bit. The pubis pubis part of the hip bone makes up a very important aspect because it joins to the ilium. Okay, on one aspect, it joins to the pubic symphysis of the other hip bone, and it joins also to the ischium to form the puboischial ramus. Right here, pubic ramus, ischial ramus, puboischial ramus that withholds the obturator foramen, the space right here. Okay. Finally, the ischium main important points is also it contributes to forming the puboischial ramus, and it also has some parts such as the ischial tuberosity and the ischial spine, which are very important for the attachment of very important ligaments, such as the such as the sacrotuberous ligament from the sacrum to the ischial tuberosity of the ischium, and finally the sacrospinous ligament from the sacrum to the spine to the ischial spine of the ischium. And those two ligaments are very important because they close the greater sciatic notch and the lesser sciatic notch to form the greater sciatic foramen and the lesser sciatic foramen. Okay, some important things, like very quickly, very easily, just off my mind. I mentioned it like that. Okay. Before I move on, I want to talk about the joints between the ilium and the sacrum. This part right here is a joint called the Iliosacral joint. And here you have three ligaments, just off facts like that. I'm just like continuously talking about it to tell you how you can give the speeches to Syrisky, like keep talking, that you give him so much information that he's bored and he's like, okay, whatever. Okay, so iliosacral ligament. Iliosacral ligament has, iliosacral joint has three ligaments on it. The interosseous ligament just found between the two bones that sticks them like glue. And then you have the anterior and posterior iliosacral ligaments. Why it's called anterior and why it's called posterior is because imagine that's the ilium, for example, and that's the sacrum, and the joint between them is the iliosacral joint. The anterior iliosacral ligament covers this joint like that, and the posterior covers it like that. So three ligaments quickly. Okay. Now I want to just dive into maybe some borders and some important features just closely, individually about those things. But before I move on, there is one important part found laterally in the hip bone, which is the acetabulum. The acetabulum has a white-shaped uh, um, white-shaped edged area here that is formed by the joining of those 3 points to form the acetabulum. So the superior part of the acetabulum is made up of the ilium. The inferior posterior part of the acetabulum is made up of the ischium. The inferior anterior part of the acetabulum is made up of the pubis. And those three form together to form the acetabulum. What is the acetabulum? It is the lateral concavity that allows for the articulation of the head of the femur for the sake of the production of the hip joint. Okay. And this is just a very general information of how you can go about creating a speech that will bore Syrisky and he will move on. Okay. Next, now we're going to discuss maybe more in details about some stuff that are present on each part of the hip bone, just so that he really thinks that you know a lot and he will stop you. He will not listen to all of this, but just in case. Ilium. Ilium has an anterior border, a posterior border, and then it has a medial border, but I'm not going to discuss the medial border or dive into it. But let's just go into quickly diving into this. Looking at this, ask a question to yourself. What part of the hip bone am I looking at? And how is it situated? Right here, it is the anterior border. Why? Is because I've seen the ACs, eyes, and the acetabular notch. Uh, Posterior border. Why is it the posterior border? Because I see the PCs, pies, and the greater sciatic notch. Okay, that's some important stuff. What is this? It's the ala of the ilium. And what is this upper border? Is called the iliac crest. Okay, the ascis, what is it called? It's called the anterior superior iliac spine, and this second edge is called the anterior inferior iliac spine, and then you reach the acetabular notch. Then on the posterior aspect, you have the pieces, which is the posterior superior iliac spine and the posterior inferior iliac spine, and that's the greater sciatic notch. Once the greater sciatic notch is blocked by, I think, the ischiotubral the sacrotubular ligament, it becomes and extends like that. It becomes what? The greater sciatic foramen. Okay. That's for the ilium. You can all dive into all the borders and details if you want, but I want to move on. The surfaces of the ilium, for example, there is the gluteal surface, and what the gluteal is, the word gluteal is relates to the buttocks, the gluteal muscle that is related to the buttocks muscle. So obviously it will be on the lateral aspect. That's the gluteal surface, okay? And it is found right here. If I That's the gluteal surface. Okay, the iliac fossa is found on the inside aspect of the ilium, and the sacropelvic pelvic surface. It's obviously going to be near the sacrum. Okay, so you have the sacro pelvic surface. It'll be close to the sacrum. The iliac fossa is found right here on the inside aspect, and the gluteal surface on the outer aspect. Pubis. Pubis is a structure that is found antero inferior part of the hip bone, and it makes part of the acetabulum, which is the anterior inferior part. And what the pubis main important features are just labeled right here: the obturator, the pectinal line, the pubic tubercle, and the pubic crest. Remember, the pectinal line and the pubic crest is part of forming that pelvic inlet anterior border. Okay, for example, and then you have some other stuff such as the pubic tubercle. Which is also an important place for the attachment of the inguinal ligament that we will study in the future. It also has a superior ramus, a body, and an inferior ramus. The inferior ramus is involved in what, as I said, the formation of the conjoint rami between the ramus and the ischium to withhold together the obturator foramen. Okay, what else? Uh, that's basically it for the ramus. Just know all of what I said is basically sufficient. You can dive into reading this if for your interest and developing your own detailed speech. Ischium. Ischium, on the other hand, also we can say that it forms part of the inferior posterior part of the acetabulum. It is made up of um, uh, it is made up of a body, a tuberosity, and a ramus. A tuberosity is called the ischial tuberosity, and as I said, it's the point where the sacrotuberous ligament attaches to the ischium. And then, of course, it has a body and a ramus, which is part of forming the conjoint ramus that will hold the obturator foramen. Okay, and you can dive all into all of those surfaces and details. You can use those to look at your bone in your lab and just see where those things are. Um, what else? Yes, the acetabulum. The acetabulum itself, as I said, is the part where the head of the femur joins to it to form the hip joint. One important feature is that it contains an acetabular notch, I think. Yes, there we go. An acetabular notch. This acetabular notch is basically on the edge. The acetabulum is made up is like this, and that's the acetabular notch, which is completed by a ligament called the transverse acetabular ligament. That's it. The surface of the acetabulum where the head joins is called the lunate surface. Okay, next. Obturator foramen. I said a lot of times what this is. Um, I think that's probably sufficient. Yeah, ligaments. It's a good idea to discuss ligaments. Sacrotuberous ligament attached to the medial border of the ischial tuberosity, as I said, from the sacrum to the medial border of the ischial tuberosity. Sacrospinous ligament attached to the tip of the ischial spine, then it goes to the sacrum. Interosseous sacroiliac ligament. Remember, sacrum, the iliac, sacrum glues those two bones together, called the intraosseous sacroiliac ligament. Anterior sacroiliac ligament. Remember, iliac, sacrum, anterior. The posterior sacroiliac ligament, posterior. Inguinal ligament attached to the asces laterally and the pubic tubercle medially. Remember, as I said, asces. There we go, here, and then it extends to the pubic tubercle. It's not clear where the pubic tubercle here is. Just give me a second. Yes, right here. So it'll be from here to here, somewhere. Okay. Next, um, uh, lacunar ligament or the pectinal ligament. Um, I didn't study this one, but the obturator membrane, the obturator foramen covers the obturator membrane, leaving a small space in its structure, and that's for the, like, I don't know if you see it, but that's that's the obturator foramen, that's the obturator membrane, leaving a small space, allowing for the passage of the obturator artery. Um, Transverse acetabular ligament, as I said, the acetabulum, and the transverse acetabular ligament does this. Finally, the iliofemoral ligament, pubofemoral ligament, ischiofemoral ligament. The pubofemoral ligament is the iliofemoral ligament from its name, from the ilium to femur. It allows for the hip joint to be strongly attached from the ilium to the femur. Pubofemoral ligament. Pubofemoral ligament is attached from the pubis to the femur. Ischiofemoral ligament from the ischium to the femur. And all of those joints, as you see, all of those joints are used to hold the femur close and attached to the acetabulum. Articulation of the hip bone. Okay, so that's the joint for the hip bone, and I'm gonna dive into it right now. If you guys want, how much is the time of recording? I don't know, but let's just do it a long video and include everything for you here. Um, mm, mm, mm. Let's see. Yeah, you can also, if you want, you can dive into the joints of the pelvis. I don't know if I should do this one yet, but yeah, let's just do it right now. Joints of the pelvis, sacroiliac joint. As I said, the one that boom, and then we have anterior, posterior. That's the sacroiliac joint. Between the sacrum and the two alas of the ilium, and you can just study it right here, and I've mentioned them already. Pubic symphysis. Remember when I said the pubis part of the hip bone joined together to form the pubic symphysis? That is a joint on itself, and it is well, secondary cartilaginous joint. Remember, always you need to know the type of joint. The sacroiliac joint is a plain type of joint. Okay. Here it is a secondary cartilaginous joint, and the articulation of the surfaces is the symphysial surfaces of the right and left pubic bodies. Okay, and then they are connected by a fibrocartilage disc. Here, ligaments: superior pubic ligament, inferior pubic ligament, not anterior and posterior. Instead, here it's superior and inferior, right there, above, below. That's it. Sacrococcygeal joint between the sacrum and the coccyx. It is a secondary cartilaginous joint between the sacrum and the coccyx. Okay, boom, done. That's the pelvis. That's the pelvic gird. Now we're going to talk about the joints of the lower limb. Quickly. أبي واقف قمرين واحد في السماء. Okay. Joints of the lower limb. First, hip joint. Quickly. The type of this joint is a synovial ball and socket. Remember, why? Ball, socket. Easy. The ball is the head of the femur. The socket is the acetabulum. The lunate surface right here, and the acetabular fossa, the ligament bridging over acetabular notch, is the transverse acetabular ligament. Okay, and then there's a round ligament of the head of the femur. This round ligament extends from the acetabulum and inserts into this ball, inserts into it, and that's the round ligament. As I said, the joint here is made up of the head of femur. Okay. It is smooth and covered by an articular hyaline cartilage, except the central depression called the fovea, which gives attachment to the round ligament of the head. So remember that this hole where the long ligament inserts into the ball of the femur is called the what is called the fovea. Okay, the acetabulum is a deep cup-shaped concavity, just like here. It's concave. It is sheet-shaped surface. It's called the lunate surface, as you see here, and there's an acetabular notch, as we discussed, covered and connected by the transverse acetabular ligament. Next, remember that in every joint there's a capsule. So what covers the hip joint is the fibrous capsule, and you can discuss and you can read more about its attachments right here. But just remember, there's a fibrous capsule. Um, what else? Here, important stuff. Yeah, you can just go read ahead, but I just want to move on. The ligaments, three ligaments strengthening the capsule externally. You have the Iliopheneral ligament. We discussed this already, and we said that in the video, and where it attaches. You can also read about it. It's very important to know, just for your information. The pubofemoral ligament, same thing, and the ischiofemoral ligament. The labrum acetabulare. Remember when we discussed the labrum of the shoulder joint, where the from the what is it called? Glenoid cavity of the scapula, it extends. There's a labrum that goes over the ball head of the humerus. Same thing here, labrum acetabulare. It extends from the acetabulum to cover that ball head or shape of the whatever is called the femur. Holy crap, I'm losing my mind. Um, and then finally, the transverse acetabular ligament. We discussed this so much. Um, um, what else? This is the ligament of the head of the femur. Probably that's the fovea that inserts into it. It's called the round ligament. There we go, round ligament. Done. It has a synovial membrane. Okay, easy peasy, lemon squeezy. Okay, boom. You're gonna learn so much about those muscles in the future, but I'm not gonna discuss it. Don't worry about it right now. Movements, flexion, extension, medial and lateral rotation, abduction, induction, circumduction, ball and socket. So many movements. There we go. Next, knee joint, my favorite. Holy fuck, that's so much. I got this question in my exam, actually, my oral exam. All right, so knee joint is a synovial, it's a condyloid synovial joint. It allows medial lateral rotation, flexion and extension. Okay, now when you talk about the knee joint, holy crap, the knee joint, you have to start by saying it is between the femur articulation of the lateral medial condyles of the femur with the lateral medial concavity condyles of the tibia. Okay, so here we're saying tibia, femur. Boom. It's not. There's nothing related to the fibula. Fibula does not articulate here in the knee joint. Does not contribute to it. Tibia and femur. Is that it? No. We have to also talk about the joint between the patella and the femur on the patellar surface of the femur. Okay, the patella is that soap-shaped bone. It's a sesamoid bone that can be felt. If you extend your leg, you can actually move that patella. That's the patella. It articulates with what the femoral patellar surface. Okay. That's the articulation. What else I can be saying is I can be talking about the ligaments of this joint. Holy crap. Before I talk about the ligaments of the joint, I want to also mention the menisci. The menisci that is found on the tibial surface that fill in the concavities. It's the medial meniscus and the lateral meniscus. And here, these are just cushioning spots for the joint. We will discuss now the ligaments, but just give me a second. I want to maybe see if I've missed something important. Yeah, we can. Okay, it's not part of the. Okay, never mind. Don't mention the fibula. You see, three articulations: femoropatellar articulation between the femur and the patella, lateral femoral tibial articulation between the lateral part of the femur and the well, femorotibial, that's just one. Screw lateral and medial. They're just talking about the medial articulation, lateral articulation, but just say articulation of femur and tibia. And the posterior surface of the patella. Uh, uh, okay, so it's just the three articulations. It's just dividing the medial and lateral, which is kind of very specific, but whatever. Just say femoral articulation with the with the tibia surface and the femoropatellar articulation. That's the joint. That's the articulations. Um, Okay, we said it. Fibrous capsule. There's a capsule around this joint, of course. Uh, uh, I wanted to see the ligaments. Yes, there we go. The ligaments, the extracapsular and the intracapsular. The ligaments that join or keep that joint in place is the extracapsular ones first on the outside. Okay, one on each side. We have the tibial and femoral collateral ligaments. From the tibial and femoral collateral ligaments, I hope they're mentioned here. They are from the femur, extending one to the fibula and one to the tibia. Tibial and femoral collateral ligaments. They are on the sides of your knee. Okay, one in front, the patellar ligament. Okay, extends from the patella to the tuberosity of the tibia, and one behind, the oblique popliteal ligament. I think there's one more called the arcuate popliteal ligament, which is not mentioned here. So it's four. It's 1, 2, 3, 4, 5. 5. Okay, just add to this notes. It's not mentioned here. The arcuate popliteal ligament. Okay, intracapsular inside. We have two cruciate ligaments, anterior and posterior. ACL, PCL. You've heard this a lot. It's called the anterior cruciate and the posterior cruciate ligaments. And what are they and where are they? Boom, they're here. Anterior cruciate ligament, posterior cruciate ligament. And you will have to study where those ligaments are attached and where they originate. All of them. Next, two semilunar cartilage menisci, as I said, medial and lateral, which are found here, medial and lateral. Okay, and we have the transverse ligament of the knee and the coronary ligaments. Transverse ligaments of the knee, right here, transverse ligament of the knee. The coronary ligament, I think it's found on the posterior aspect. I think it's not found here. Is it? Yes, it's not labeled here. Okay, but these are ligaments. You're done. Um, um, and look, they're just going ahead here to discuss where the ligaments are attached and stuff like that. You can go ahead and look at it. It's very important. And there we go. You have all the details of these ligaments. You have what else? Yeah, so many things for you to read about. But it's good to dive into this and know exactly what the fuck is going on. Okay. There we go. All of them. I've discussed most of this. Just dive into details and see how you can fit all of those around each other. Okay, that's what is it called? The knee joint. Okay, the more I look at the notes, I remember more stuff to mention, and that's good. Let's dive into maybe the ankle joint first, or let's just do the joints between the tibia and fibula. Okay, we have first and foremost, it is a synovial. Okay, so we have the joints between the tibia and fibula. Just like we have joints between the radius and the ulna, we have joints between the tibia and the fibula. And we have three joints between the tibia and the fibula, just like we have three joints between the radius and the ulna. First one, synovial plane joint. It is called the superior tibiofibular joint, and the articulation is between the fibular facet of the tibia, the articular facet of head of fibula. Okay, movements, sliding movements. It's just plain sliding movements. The interosseous membrane between tibia and fibula, it is a fibrous joint, syndesmosis, remember, type of joint. And here you have, it is basically an interosseous membrane that is joining the interosseous border of the tibia with the interosseous border of the fibula. And is found all across this, the structure of those two bones. The inferior tibiofibular joint, fibrous syndesmosis, very weirdly here, it's different from the superior one. And the articulation, of course, is between the fibular notch of lower end of tibia, the medial surface of the lower end of fibula. Okay. You can study the ligaments of this joint because I think these ligaments are involved with the ankle joint, but it's the interosseous tibiofibular ligament. Interosseous, when you see the interosseous, it's directly between them. It's like a glue, okay? Anterior tibiofibular ligament and posterior tibiofibular ligament. That's it. Next, ankle joint. Boom. Boom, boom, boom. Okay. يا ويلي ايش تعبت. Okay. Ankle joint, synovial joint, hinge. Hinge, okay? So why is it hinge? Is because you can move you can move your foot like that. That's why it's hinged. Okay. Articular surfaces, very good. It's between the medial malleolar process of the tibia, but the lateral aspect of the lateral articular aspect of the medial malleolar process of the tibia with the medial articular surface of the talus, and this is where the tibia articulates medially with the talus. Now, there's also one more articular surface of the tibia with the talus. It is the superior. So that's the head of the talus. The tibia articulates here and here because the tibular inferior surface is like that around the talus. What's left? The lateral aspect of the talus. It's between the lateral malleolar process of the fibula with the lateral aspect of the talus. That's basically the articulation surfaces of the ankle joint. So many ligaments to be studied. It does have a fibrous capsule, and you can read about it. But the ligaments, you have the deltoid ligament, and this deltoid ligament is made up of so many others. I don't know, where is it. Wait, why is it not mentioned here? It's one of the strongest ligaments in the body. Yes. Attachment. There we go. There's basically they're basically mentioned here, I think. I've studied them into separate ligament names, actually. Superiorly attachment by the apex of the tip, medial border. Okay. Lateral ligaments. Okay, so just study, maybe just know the deltoid ligament. But this deltoid ligament, if you search it up, I think it'll have three or four different individual parts. Okay, just dive into the deltoid ligament, and then the lateral ligaments of the ankle. So the medial aspect has the deltoid, and the lateral aspect, it has those three that I'm going to mention right now. Anterior talofibular, anterior between the fibula and the talus. The calcaneofibular ligament, it is between the fibula and the calcaneus here. The posterior talofibular ligament between the fibula and the talus. Right. Oh, sorry, it's right here. Talus, right here. Between the where is it? Yes, between the fibula and the talus. That's the talus. Okay. So that's the calcaneofibular, that's the posterior talofibular, and that's the anterior talofibular. Wait, what do you say posterior here? Okay. Yeah. Okay, because we're looking at it from a different perspective, but you get it. Anterior and posterior. Okay. What else? You can look at the structure of those bones, and I hope I can just get a 3D model to just look at it and see and show you guys how the bones are situated, maybe in the future. But this is it, and the movements of this bone is dorsiflexion and plantar flexion. Joints of the foot, yeah, Willie. Okay. Yeah, maybe I will dive into this one in another video because I don't want this to be very long. Wait. I mean, it's easy. Okay, let's just do it. Okay, joints of the foot. You have the subtalar joint, which is between the talus and the calcaneus. Okay, and it's a type of plain synovial, and it is between the lower articular surface of the body of the talus and the posterior convex facet on the upper surface of the calcaneus. The calcaneus is down, talus sits upon it, so that's why it's just makes sense. Ligaments, the most important ligament here is the interosseous talocalcanear ligament. Glue, again, talus calcaneus. And eversion and inversion movements. The talocalcano-navicular joint. So you have talus, you have calcaneus, and then anterior to those two, we have the navicular. So the navicular, like it'll be here. Okay, how can I show it? It'll be here. How can I want to see a picture. Let's see. So here you have the talus, you have the calcaneus, and that's the navicular. You see, it's not a good image, but the navicular touches both the talus and the calcaneus, and that's why it's the talocalcano-navicular joint. Okay, it's a synovial, and it does say here a modified ball type of ball and socket. Like the ball is formed by the head of the talus, okay, and the socket is formed by because it's touching both of those two things by the calcaneus, and yeah, I advise you to go look at how that's situated because it's so hard to imagine it right now. And finally, the calcano-cuboidal joint between the calcaneus and the cuboid bone. And it's a part of saddle joint and the anterior surface of the calcaneus and the posterior surface of the cuboid. The cuboid is found anteriorly to the calcaneus. That's it. The movement of the ankle joint is inversion, eversion, of course. And there's one more type of movement. There's so many joints that I don't think Syrisky have concentrated so much on the joints of the foot really, but maybe you can just study it. But there's also the composite joint, the tarsometatarsal joint, and then these are the ligaments of the foot. Just go over it and read it. But these are so many details, and once you start mentioning the bones of the foot and stuff like that, and the joints and everything, he will just be bored and be like, whatever, let's go. But study. It's always important. Thank God this is actually a very good guide. You can look at it later. Okay. Thank you for joining us for this video. I've hoped I've covered all the joints of the lower limb. Soon we're gonna make discussion session about the lower limb and yeah, the scapula, the pelvic, what's it called, the pectoral girdle. Okay. Thank you very much for joining. See you guys in the next video.